What if optimizing your metabolism was the key to unlocking your best life? Welcome to the Life Possible podcast, where we bring you cutting-edge insights, real-life transformations, and powerful strategies to help you win the fight against obesity and metabolic disease. Join host Dr. John Barnes as he explores the science and stories of transformational metabolic health, because when you fuel your body right, you unlock your greatest potential. From leading experts in nutrition and wellness to inspiring success stories, this is your go-to resource for education, motivation, and empowerment on your journey to a healthier, more vibrant life. Your best life isn't just possible, it's within reach. Let's make it happen together. Here's your host, Dr. John Barnes.
Hey, Ideal Protein Nation, we are back. We are back and better than ever. Super excited to bring you this episode. I might say again, because the backside of this story is I recorded this episode with my featured guest a couple weeks ago once, and evidently the Google Cloud went down, and so did our episode. And so I'm very blessed that she graciously agreed to come back again and do this over for you guys, because this is a super important show. So let's get to it. For those of you who may or may not be familiar with the Life Possible podcast, I started the Life Possible podcast back during the pandemic 5 years ago to spotlight successful clients, coaches, and clinic owners who have used the Ideal Protein program to transform their lives and the lives of others. And recently, we've expanded the show to actually also talk with some experts in the field, not related to Ideal Protein, in ketogenic, low-carb nutrition, metabolic health, and fitness. So we've been having a really, really great time here. I hope you've been enjoying the episodes. And, for those of you who don't know me, my name is Dr. John Barnes. And, there's no easy way to put this, but back in 2015, I found myself fat, sick, and depressed. And the most challenging part of that is I didn't see a way out. So I gave up. And the long and short of it was I truly feel that God brought me the Ideal Protein program through one of my chiropractic patients as the answer to so many of my prayers, both personally and professionally. Um, Now I've started this podcast to try to reach as many people as possible so that they might be able to transform their lives in the exact same way. So who do I have for you today? Well, I tell you what, I've got Dr. Linda Huang. Dr. Linda graduated with honors from Stanford University in both biology and music, and completed her med school residency training at Northwestern University in Chicago. She has been board certified in internal medicine since 1997 and is an attending physician at Northwestern Memorial Hospital herself. She serves as a primary care physician in the Chicagoland area and as a clinical instructor at Northwestern University Med School and residency programs. In 2013, Dr. Linda broadened her education beyond traditional internal medicine and received a master's degree in metabolic and nutritional medicine. She's board certified by the American Board of Anti-Aging Medicine and completed an advanced fellowship in anti-aging, regenerative, and functional medicine. Also in 2013, Dr. Linda discovered the Ideal Protein Protocol, incorporated it into her practice, and is still successfully using it with clients today. Without further ado, let's bring Dr. Linda in. Hey, how are you?
Hi, how are you doing?
I'm doing great.
Good to see you.
I just want to say thank you so much for agreeing to do this again.
Oh, you're most welcome.
We put together such a great show last time, and I was just devastated when I realized that the Google Cloud had gone down and we lost it all. So I think that we're going to one up what we did last week today on the show.
No, I think that sounds like a good plan to me.
Excellent. Well, let's jump right into this. I find that people like yourself who are passionate about what they do, especially in this space of functional medicine and nutrition, et cetera, they got there from a personal experience. And I know that you've got an incredible personal story yourself that has kind of led you to this place. So let's start there.
Yeah, I think I like to kind of share with the audience a little bit about pivotal point in my life and career. And basically, when I was 35 years old, I was diagnosed with a fairly aggressive type of ovarian cancer that had actually involved the colon. And so at that time, I was age 35, and
Yeah.
needless to say, lots of questions come to mind. And I think I foremost wanted to know, where did this cancer come from? We didn't have any family history of cancers. So that was one question. Second of all, I was wondering, how would I get myself, in addition to how do I recover, not just from the cancer, but also from the effects of the treatment, from the chemotherapy and radiation that I
Yeah.
received.
Wow. Yeah.
Yeah, and then finally, basically at age 35, I went through surgical menopause. And
Wow.
so, that's not a good thing to do so early in life. And
No.
I was worried with all the diseases that comes with lacking hormones so early in life. Coincidentally, this happened back in 2005. And in 2002 was when that big women's health initiative came out with a big study that basically took away all prescriptions for menopausal hormone replacement therapy. Because,
Yeah.
you may recall that big study came out in 2002 and basically said that menopausal hormone replacement therapy can cause increased risk of blood clots, strokes, and also breast cancer. So pretty much there was no menopausal hormone prescriptions being written in 2005. And
Wow.
so, yeah, and so I think, for all of those questions that were going on in my head, I was trying to find some answers. And unfortunately, while allopathic internal medicine training is fantastic, it really was not very helpful to help me find answers to these questions. Internet was very limited back in 2001.
Right.
So it
Right.
wasn't as easy to find information. And
Yeah.
also integrative world, integrative medicine was also not that well, either people just were not as trained and
Right.
they sometimes not accepting of it,
It
basically.
was, yeah,
So
not that popular yet. Not
yeah,
really.
exactly. And I didn't even actually, as an internist, I'd never even heard of functional medicine back then.
Yeah.
So I found myself attending one of the International World Congress Anti-Aging Functional Regenerative Medicine meetings. And during the meeting, I remember one of the first slides that a speaker, it was a gynecologist from Emory Medical Center, and he puts on a slide of these processionary caterpillars.
Yeah.
And I don't know if you know about these caterpillars, but I learned
No.
basically these caterpillars are fascinating. Whether it's via their pheromones or via neurotransmitters, but they somehow just line head to tail to whichever caterpillar is closest to them. And so such that if you kind of like enclose them in a box, they basically find the next one and they eventually will form this circle, and they just keep,
They just keep going around and around.
in a circle, without asking any questions. And so
Right.
the speaker's point at that time was that we're practicing medicine much like these processionary caterpillars,
Wow.
where we would basically get some guidelines in terms of, okay, prescribe this for that. And then that's all fine until FDA decides to recall something. And then we all stop and then we find the next thing. And so
Right.
we're really like spending time digging through root causes of things. We were starting to do what I call kind of band-aid medicine.
Yep.
Meaning that we have somebody with a complaint, with a symptom, and so we basically write the next prescription.
Yeah.
And one of the kind of bad jokes that we used to talk about was that when a menopausal lady comes in, we basically only had two prescriptions to write. One was an antidepressant such as Prozac to help
Right.
them with their mood, and one was a birth control pill to help them regulate irregular periods. Um,
Okay.
and that's not even taking into consideration that both of those medicines can actually help put on weight, which
Yeah.
is a common complaint of our patients.
Just compound what's going on there in menopause, right?
Yeah, exactly. And so, the other kind of thing that was always on my mind was actually about diabetes at that time. I always, as an internist, felt like we weren't really making any progress in terms of helping our patients with diabetes. And
Yeah.
because I felt like other than metformin at that time, most of all the other diabetes medicines actually puts on more fat and adds more weight, which further worsens the insulin resistance and diabetes. And
Right.
so it just was not very helpful for our patients to practice medicine that way.
Yeah.
So when this during this conference, I started to learn about functional medicine, which makes a lot of sense to me. And so functional medicine to me is just basically a very holistic way, kind of looking at the whole body.
Yeah.
We look at genetic predispositions, but then we look at the important environmental factors, whether it be toxins, things that we are exposed to, it could be medications. And then we look at all the other parts, whether it's hormonally, nutritionally, our immune system, our gut health. Often we forget our gut, the
Right.
microbiome of our gut is actually one of the biggest surface area for our immune system next to our skin barrier.
Right.
We look at making sure that there's no inflammation in our body. How do we make sure our immune system is working for us? And then also, I think importantly, is about stressors, whether it is mental stressors, physical stressors, all of these
Yeah.
can affect our body. And so, when I learned about this, it just is practical. It makes sense. We don't dissect the human body into little parts and just take care of
Right.
we try to find basically the root cause.
And
One
so
oh, go ahead. I'm
and
sorry.
this is what a lot of people refer to as holistic medicine, right?
Exactly.
Looking at the whole person as opposed to, like you said, literally siloing each part of the body and seeing a different specialist.
Exactly. One thing I always, again, I'm still foremost internal medicine in training. And
Yep.
as I tell my patients, I said, it's fine to put out the fire first. If we have to
Yes.
prescription to keep the house from burning down, I'm all good with that.
I
But
love
I
that.
think ultimately we need to try to see if we can figure out how the fire got started in the first place.
Yeah.
And that's kind of, I shared this with you because that's, I think, how I, practice medicine with all of my patients.
Yeah,
Um,
no, I think that's a brilliant analogy for that, and I think most people can certainly respond to that, right? Life-saving medications have their place, and like you said, let's put out that fire,
yeah,
but let's figure out why the fire started in the first place, and see if we can't address those things. That's so awesome.
I think it's pretty logical, and
Yeah,
I think it makes sense, and it makes sense to pretty much everybody I take care of. So it's been a great eye-opening way to kind of look at how we practice medicine in my practice.
yeah, absolutely. And one of the reasons that I was so excited to have you on the show is you have this reputation for specializing in women's health issues, particularly menopause. And so, now we understand why. You're certainly going to do everything you can to research it and work with it because it's such a big part of your personal experience since the age of 35, which again is just mind blowing.
Yeah, seems like a long time ago, but I think it's been, both for personal reasons and also, like I said, a lot of women were affected back in the 2000. Thank goodness, a lot of the Women's Health Initiative info now, it's been debunked and hormone
Yeah.
replacement therapy is back. So I think part of our discussion today is also to kind of make sure women understands a little bit about what's going on during menopause, how that
Yeah.
affects our metabolism and their efforts to improve their body composition. I think this is a good good subject. I think very important. too.
Absolutely. It is definitely something that I've had a lot of requests from listeners and viewers, especially clinic owners and coaches. So we're very excited to get into this. And again, as a man, I know nothing about this. I just know the exterior effects, so to speak. And I'm going to try not to get myself in trouble during this show. So if you could, Dr. Linda, start to teach us, can you teach us some of the hormonal shifting that happens when a woman is moving into menopause? I found this fascinating, and I still have my notes written down from our last show.
Oh, I see.
Yeah.
So, in menopause, I think I usually will start talking about what most of us are familiar with, which is the drop in estrogen. During menopause, it's actually the 17 beta estradiol that is the active hormone. But I think for the sake of, purpose of our podcast, we'll just call it estradiol estrogen. And so the one that most of us are familiar with is just basically our estrogen level drops. Now, estrogen has very important role in terms of a woman's metabolic health. And so one of the things is it does affect how our fat is distributed.
Yeah.
And so, this is a common thing you will, I'm sure every woman that's menopause, I hear this all the time, is about the belly fat. And so, the fat distribution actually changes as our estrogen level falls. And so now we distribute more abdominal fat. And unfortunately, abdominal fat is part of the metabolic syndrome that makes us more prone to developing diabetes, strokes, and heart attacks. So it is important to address that change. Second of all, estradiol also has this role in terms of improving insulin sensitivity. And so when hormone level drops, it actually makes us more have the potential to become insulin resistant due to the hormone deficiency. And then one important thing to know is also that estrogen actually has a role in terms of our mitochondrial function. And the way to think about mitochondria, I think of it kind of like as the factory that generates energy for our cells.
The powerhouse of the cell, right?
It's the most important thing, right? It keeps our cells alive and has energy. And so estrogen deficiency during menopause can cause mitochondrial dysfunction, which now can impact our energy metabolism.
Got it.
So, often in my clinic, I'll hear patients come in who are in menopause and they'll complain of kind of like a low level energy state.
Right.
Sometimes they feel like their exercise capacity is affected, their muscles are weaker. And we know these symptoms are related to this mitochondrial dysfunction that's affecting our energy metabolism.
Got it. Yeah. Actually, the low energy and the shift towards abdominal fat seem to be just a couple of the myriad of symptoms that we see during menopause. And I loved, I loved if you could roll through the dwarves for us here real quick. I love this graphic that you gave me that you use in some of your talks.
Yeah, I think these are just a way to lighten it. Unfortunately, those of us who's gone through it may or may not, depending on how we're feeling that day. But these are just common symptoms, of course, we know about hot flashes. Sometimes it could just be night sweats. A lot of these are also, actually some of the other symptoms I wanted to bring up is that there's the menopausal fogginess, the brain
fog,
the brain fog that women will complain about, which again related very much so to the estrogen deficiency that can affect our cellular energy, the mitochondria.
Yes. Yeah.
The sleep is a big one, which I'm going to talk a little bit about when I talk about progesterone, because I do think that is important. All the other ones I think are pretty self-explanatory. I don't
know. You jumped right over bitchy. I don't even like.
Because I'll talk about that when we talk about progesterone. No, just kidding.
Staying out of trouble.
I think you were going to stay out of trouble, right, for this one. But again, I think, while this is, kind of lightens up the symptoms, it is
it's very real
time. For women, I have people that come in that are either, some women are very fortunate. They don't notice anything, but they are not the norm. I would say majority
Yeah.
of ladies will have at least 2 to 3. I would say the most common things, in addition to hot flashes that people know about,
Yeah.
is actually sleep disruption,
Hmm.
mood,
Hmm.
anxiety, I always tell people it's not just about the dropping of the hormones. It's actually about how hormones interrelate with each other.
Yes. Yes.
I just want to make sure people know it's not just like, oh, we just give you estrogen and everything is perfect. Because hormones to me, and maybe it's because I'm a music training background, but to me,
Yeah.
it's kind of like a symphony orchestra.
100%.
Yeah, I mean, I think, and it makes a lot of sense, right? You can have the best musician playing the cello, you can have the best one playing the violin, but if they don't play together, well, you're still not going to make good music. In fact, you can make pretty bad music if they're not playing together. So, one thing to have people recognize always is the symphony, the how they interact with
Yep.
each other. That's important. Oh, I see that you have my pyramid of hormones.
Yeah.
This one I'm gonna talk about this pyramid after I talk about the other hormones, if I may.
Yeah. We'll keep bringing it back and forth. I
If that,
just,
yeah, if that's okay with you. I
I,
definitely often draw this picture for my clinic patients to talk about the different, you can see on the top, I don't know if you can read, it's a little bit light, but cortisol hormone is basically what I call the king hormone that sits on top of the pyramid because I feel like it governs
right.
everything. And the reason I say that is some people may think, oh, but insulin, and obviously they are all important. The
Yeah.
reason I feel like cortisol I put on the top is because cortisol is our acute stress hormone. Okay. It is what gets us
Yeah.
out of trouble. It's released when we need an acute stress response to get us out of that, it's that fight, flight, fright signal that we get out of acute stress, basically.
Yeah.
So I put it on the top because we have to have that to get out of the immediate stress before we talk about insulin storing things. I call it storing for a rainy day, basically insulin.
Yeah. Right.
But this will make more sense too when we get more
Yeah.
into it. Like we can bounce
Yeah.
back and forth with it. I think I wanted to kind of finish, John, if I may, about the
Yeah.
estrogen
Yeah.
because in addition to the mitochondrial dysfunction, I just want people to understand that there's so many things that can happen when the mitochondria is not working well, when it's not functioning
Yep.
properly,
Yep.
because it can actually also cause fatty acid to to deposit in our muscle cells, which can actually worsen insulin resistance. So it
Wow.
affects also different forms, like also in our fat cells. It can also cause basically inflammation in our bodies. So I just want to make sure people know that when estrogen falls, if we don't have the proper support, it can actually cause inflammation, worsening insulin resistance, decrease in energy level, and a lot of that can contribute to some of the symptoms that we were showing before with the dwarfs also.
So it seems to me, there's kind of two different scenarios that I see with my female clients as they come in. Some women were insulin resistant before they reached menopause, and so that insulin resistance then actually is heightened or exaggerated. And
Mhm.
then some women they've been really pretty insulin sensitive for most of their life, and so they're the ones that are kind of the most surprised by these changes that are taking place,
Mhm.
like you said, as the estrogen drops, and all of a sudden now they might have been on the verge, but now they start to go into full blown insulin resistance, and we start to see those effects. Is that a common occurrence?
Yeah, and I think we often hear women will come in and they will talk about, hey, 5 years, they may be, say, like entering that perimenopause, like 40 to, before they actually stop all ovulation and have no
Yep.
menses. And they'll often say things like, oh, 3, 4 years ago, I was able to, when I gained weight, I was able to do this, and then it was corrected. And I think that's when you're starting to already having the hormonal shifts. And so as they continue to enter that continuum,
Mhm.
until the ovary
Yes.
completely shuts down. Yeah.
Yep. Yep.
So it's like
It's a continuum. Yeah.
exactly. So, whether you call it perimenopause, menopause, those are just terms. I always tell people just know that our hormones with each decade changes.
Mhm.
It will in the 40s, you will definitely notice that change. And insulin resistance is a continuum. It's not like one day you
Yes.
wake up and all of a sudden this happens.
Right. Right.
So I think you're totally right when you brought that up. Um, the other thing, the other hormones I keep hinting at, but I haven't talked about, is the progesterone.
Okay.
And I wanted to talk about the progesterone because I feel like we talk about estrogen a lot.
Yeah.
Um, and progesterone is actually very important because of a couple of things. We know when a woman is deficient in progesterone, when they enter menopause, they stop making progesterone also. The progesterone being deficient can actually cause muscle achiness. So,
Hmm.
like joint muscle pain is actually a very common complaint we hear about in menopausal women. And so, unfortunately, that sometimes leads to more decreased activity, which is not helpful also when we're talking
Right.
weight management. And then one important other thing is that often people don't realize this, but progesterone actually have what we call a GABAergic effect. So that's capital GABA for those who are not familiar with it. And
Mhm.
so the GABA system in our body, think of it kind of as the counterpart to like the counterpart to our excitatory nervous system. So we know
Okay.
like most of us know like the
Uh,
epinephrine, adrenaline, norepinephrine, those are like our excitatory system. Well, we always have the other part to kind of turn it
right.
off. And so in our body, it's called the GABA system. And so progesterone, via one of its primary metabolites, it actually has a calming effect.
Wow. Okay.
So now imagine when you enter menopause and your progesterone is low and you're losing that calming effect. So
Right.
now you see the sleep disruption, the anxiety level goes up, irritability and mood. And so that's why when we were talking about the dwarfs, I said I'll talk a little bit about the second dwarf when we get to the progesterone a little bit because
Yeah.
the second one, right? Yeah. So when we talk about a lot of these things, because sleep to me is so important, both for your immune system, both for when we're talking about weight management. In fact,
Mm.
um, one of the first questions I always ask people who come to me about weight management, one of the first questions I always have to ask is about their sleeping habits because when we don't sleep and we are staying up at nighttime, which is not uncommon in the United States, we stay up late,
Right. Right.
working all day. And what we're doing is we're pushing that king hormone that, on the top of that pyramid, the cortisol. We're
Yeah.
pushing that cortisol to stay up with us when it's actually is supposed to drop in the evening so that our melatonin can go up. As the cortisol decreases, our melatonin goes up, which allows us to have good sleep hygiene. But
Right.
we often push ourselves to stay up later, whether to check email, look at the last thing on our phone.
All
Uh,
the blue screens. Yeah.
yeah,
Yeah. Binge
exactly.
watch Netflix.
No, exactly. And so now our cortisol is forced to stay up with us. And what does cortisol do? Well, cortisol, think of it as kind of like the steroid that's in our body. In fact, it is
Yep.
a steroid in our
Right.
body, right?
Yep.
Just like taking oral steroid medications, cortisol will kind of make us crave for salt, for foods, for sugars. It will pack on fat centrally, all the things that we're trying to improve.
Wow.
So, again, when somebody wants to lose weight, the first thing is always to make sure that we can make their sleep habits work for us instead of against us.
Wow. Wow. No, I think that's brilliant. That was something that I learned when we recorded the first time. And that's a question that we don't even ask. So that's certainly going to start we're going to work that into our system here. Goodness gracious.
Yeah, no, I do, I mean it when I say cortisol is a king hormone.
Right.
You know, I don't want to get too much into it, but there's this whole entity, functional medicine talks about adrenal fatigue quite a
Right.
bit, which basically means that your cortisol function is disrupted. And when you're trying to help somebody lose weight, if that cortisol is fighting you for the weight loss,
Yeah.
it
Yeah.
will always be very difficult. So it's important aspect to address.
Well, and like you said, so that is the one thing that we do ask when we've got somebody, they come in, they're struggling, doc, nothing happened this week. I don't understand it, blah, blah, blah. And then I'll say, well, how is your stress level? Well, it's through the roof, right? I got work is here. I'm dealing with this person here and all the things. And so, yeah, that might be one of the mechanisms by which cortisol is stop blocking the fat loss.
Yeah, no, you're totally right. And I was talking mainly about sleep, but you're totally right. Mental stressors, physical stressors. People who actually think, "Oh, we're just gonna go work out more." To
Yes. Yes.
how often do we hear that, right? "Oh, I'll just
Yes.
eat less and I'll work out more." That is not gonna work. When we are beyond 20 years old, that doesn't work anymore because cortisol at the end of the day is a stressor on our system, and
Right.
so you're totally right. It's physical and mental stress. It's not sleeping stress.
Yeah.
All of those can contribute, but they can be managed. So I don't want people to get discouraged.
Exactly. Well, right. And that's kind of the good news aspect of this, right? Is
Yes.
that, there are these lifestyle, it's lifestyle. It's not just nutrition. We do need to address these other things,
Mhm.
and sleep and exercise and stress management is certainly a big part of that equation for weight loss and management, right?
Oh, exactly. Exactly. Again, looking at holistically, I like
Right.
to call it. Yes.
Right, absolutely, and each one of those things contributes to insulin resistance, right? And that truly is at the core of most people's issues, and it's something that we like to address with all four of those things: nutrition, exercise, stress relief, and sleep.
Exactly. Exactly. And one thing that I find that the ideal protein program, as you mentioned before, we've been using it for quite a while now. I think 13 years now into our practice.
Yeah,
One thing I think is great about the program is that it does address this underlying rebalancing of our insulin hormone and
yes,
sensitivity. And it's so important. And for me as an internist, there's so many weight loss programs out there. And for me, this is the only one I've ever adopted to use in my internal medicine practice. Number one,
yeah,
because I'm very skeptical. There's just a sea
right.
of things out there that are the weight loss industry just has so many things, and most of them just I've never adopted one. I like the IP program because it does get right down to trying to correct the underlying metabolics, and it's been
Yes.
working great for my patients. I don't know if you know this, but like for our practice, we managed to get everybody off their diabetes medicine, other than we keep the metformin on
Right.
because there
Yeah.
is actually additional benefits for it. It doesn't put on weight. It helps them as we go through the maintenance phase. But that IP, I felt like the phase one protocol is so wonderful and
Yeah.
doable and has a beginning and an end for the protocol. I just find it invaluable to use. And we still continue to do it in our practice very successfully.
Yeah, I loved that. You were talking about as far as helping to really improve the metabolics for type 2 diabetics, get them off their medications and teach them how to balance their sugars and A1C. Tell us a story too. I thought it was fascinating, and I want to give him the shout out. But the story about how you found actual ideal protein.
Yeah, so I'll give him credit again. So as to you, I actually came across the booth for Ideal Protein at one of the A4M, which is the Anti-Aging Functional Medicine
Yeah,
International Conferences. But the reason it even came across, because often, like I said, there's just sea of vendors and things,
so
and
many. Yeah,
Yeah, and so I mentioned to you last time, I'm going to give credit to my husband again, who actually they're also doing a metabolic program for sports medicine, and so he was very interested in it, and he's the one that brought me over to hear about the IP program. So he. I'm grateful that he brought this to my clinic and my patients, and before we implement it, both of us, of course, have to do the walk
Right.
to see if it's doable for our patients.
Yep.
And I'll be honest, even now, um, I feel like it's a great program whenever we deviate, even
Yep.
if it's not insulin resistance. We know ketogenic diets are helpful and healthy. We've known since 1920s when
Yeah. Right.
ketogenic diets were used to treat epilepsy and seizures.
Yeah.
We know it is a healthy to go low glycemic carbs. We know it's good to burn, fat cells to decrease the cell size.
Yep.
Actually helps reduce inflammation. It's just how our body works. And so, but when I found the protocol, what I liked a lot about it was that, as I said, it has a beginning and an end to it, meaning that somebody doesn't have to technically be on the diet all the time. And I
Right.
like that it also has positive reinforcement. We feel better when we embark on it. We see the weight loss if we do the protocol with the backup of our coaches. I think that it works well. Like I said, I think for me as a physician, correcting the underlying metabolics is so important. And then
Yeah.
finally, I think the one that I feel like a lot of programs out there just doesn't have it is the maintenance part.
Yeah.
Ketogenic diet, we know can lose weight. The question is, how do we help somebody maintain that lifelong? And I really
Right.
feel that's the strength of this program. My dieters leave the program knowing how to maintain at any situation. It's not like they're
Yeah.
in a bubble and just eating packaged foods,
Right.
but
Right.
how you live. So
Yeah.
I think for all those reasons, I just feel like it is such a great protocol. It's not one size fit all. Like I said, everything, it should be a multifactorial thing, you
Right.
know, fixing all the other things that we talked about, helping somebody optimize hormonally,
Yeah.
deal with stressors, changing habits in our lives, is it's a good thing.
Yeah, I'm so heartened by everything you just said because we just last week, myself and a team from Ideal Protein Corporate were at the Society of Metabolic and Bariatric Surgeons convention. And so we manned the booth. We were there at the booth where, your husband brought you over to test the products and to talk about it and all the things. And we had such a great time. People, doctors and registered dietitians, when they come over, number one, they're so amazed at how good the food tastes. And we had people that were repeat customers, every day they'd come by and say, do you have some more of those? Do you have some more of those? And number two, they love the concept of the structure and the idea that it is an inside out protocol, right? So we're kind of getting metabolically healthy on the inside so that we can burn that fat off on the outside. And I love, like you said, correcting those metabolics, restoring metabolic health first, and losing weight as part of that process.
What is such a
So
way to put it in terms of the inside out process.
yeah,
And one of the things wanted to also, I didn't bring up before, but one of the things that's also, I like to see concrete data, objective data.
yeah,
And honestly, the metabolic profiles, the blood test of my patients who, especially people that have the metabolic syndrome, the high triglycerides,
yes,
the
yes,
hemoglobin A1Cs that makes
yes,
us, we know when it's elevated, we can develop diabetes. And the fatty liver disease, it is
yes.
remarkable. Like if I show some of these data of the before and after, it's, it's there. It's no ifs, ands, or buts. It can correct it. And that's what I get excited about,
A
uh,
100%. And again, as a physician in your position, right? For me as a chiropractor, I'd never before been able to change anybody's blood markers, right? But doing this program, it is mind blowing, like you said, and it's predictable, it's repeatable, and it's measurable. That's one of the things we love saying. Those 5 factors of metabolic health, whether it's BMI or waist circumference, blood pressure, and triglycerides, HDL, and blood sugar. We can see those change in a very predictable pattern when people adhere to that program, right?
In fact, sometimes I remember early on, I also check like their inflammation marker.
Yes.
There's a C-reactive protein marker that I used to like to kind of just collect the data on my before and after patients. And we all know diseases come from inflammation. As I just finished saying about, fat cells, visceral fat, increased inflammation. What was nice to see was a lot of the inflammation markers actually improve. When people are successfully doing this,
Yeah.
this lifestyle change. So,
Yeah.
it's like I said, I wouldn't do it in my office unless I think it is so valuable and so
Yeah.
doable. Um, the one thing, John, I know we were talking a lot about menopausal women.
Yep.
Um, and we kind of touch I don't know if you were touching a little bit about it. I wanted to just kind of highlight something that your listeners may or may not be aware of, and that's about polycystic ovary syndrome.
Yeah.
Perhaps
PCOS.
a little bit about it. I just wanted
Okay.
to make sure. I know we're focused right now on menopausal women, but I do think it is something that is really been on the radar of both internal medicine gynecologists, especially recently. And
Yeah.
so PCOS is polycystic ovarian syndrome. And what I would tell you, back in the days when I was a medical student and in training, this was more like a syndrome that was more associated with younger women.
Yep.
We kind of thought of it as just basically young ladies that came in with unwanted facial hair. They have irregular periods or no periods. Sometimes as they get older, they have problems with fertility. And so
Yep.
that's kind of like what when I was in training, that's kind of, it's a
It was
thing,
the profile.
gynae rotation, basically.
Yeah.
And they don't even have to have cysts in the ovary. In fact, not all PCOS patients, only half of them actually has the cysts in the ovaries. But that was
Oh,
actually how. Oh, go ahead.
can I ask a question then? Because I remember you saying that when we were recording before. How about women who do get ovarian cysts?
Mhm.
Do all women who get cysts have PCOS?
No, not
No.
necessarily.
Okay.
So
Okay.
it really is. PCOS is actually a diagnosis now. There's like kind of 2 out of 3 criterias
Got
that
it.
they have. So cyst in the ovary is one of the ones. If they have that in addition to one of the other ones, basically. So it's
Okay.
2 out of the 3 of the criteria. So you could have basically just problems with ovulation. You could have just that with the facial hair, um, that alone without the cysts in the ovaries. And
Got
even
it.
then, we used to associate it also with weight issues, but not all
Right.
PCOS patients actually
Yeah.
have to be
Yeah.
overweight. And what we're learning, it was interesting. I was at a American College of Physician. It's a big internal medicine conference, but
Mhm.
PCOS is actually now classified as a metabolic condition for women.
Right.
It's not
Right.
it's a metabolic condition. And the reason for that, and the reason I'm bringing it up, is that women who has PCOS actually has a lifelong risk for developing insulin resistance and all of the metabolic syndrome things that we were just talking about.
Right.
So it's important to bring to the attention, and I wanted to kind of bring it up to our listeners, is because once upon a time we used to think, oh, once you hit menopause, PCOS is in the past because we're not
Got
menstruating.
it. Yeah.
We don't really, and in fact, a lot of PCOS patients, when they hit age 40s, their periods actually become more regular. And so, um, but now we know that women with PCOS, lifelong, they should be screened and monitored, and they should also take precautions that we've been to always help sensitize their insulin function.
Right.
And one of the things is, like, back then it's easier to tell. Now it's hard to tell when a woman actually has PCOS, right? Like, we have
Right.
aesthetic laser treatments. People just don't come to us about their facial hairs anymore.
Yeah. Yeah.
Birth control pills, regular periods. So it's harder to pick up. So, internists should always ask about a woman's previous cycles, when they were younger.
Hmm.
They don't, it's important if you are a woman who kind of remember, hey, back in the days, I remember this and that. It is important to kind of say, hey, could I have had PCOS and just didn't know about it?
Right. A
So
lot of it goes undiagnosed, right?
yeah. And so
Yeah.
I just bring that up because I do want people to be aware that's a metabolic uh, condition associated with insulin resistance. And again, kind of making sure that anything that we're talking about in terms of improving that sensitivity, that they are also aware to pay attention to.
Yeah, and so now I know that there's a fair amount of studies out there on ketogenic nutrition. Again, with the concept that the ketogenic nutrition rolls back that insulin resistance, and when we do that, so when we get some more hormonal balance there, a lot of times we'll see that the female hormones will balance out, right?
Definitely.
And again, I'll reach back to a couple of my episodes of the Life Possible podcast. I've had two really amazing guests who have been through this. One was a 20-something who wanted to have children, and she was told that she had to lose 100 pounds before they would even consider doing fertility treatments. And she did ideal protein and got to about the 90-pound mark, wasn't even considering the possibility, and got pregnant.
Oh, that's a great story.
Yeah, so great. Jill Bailey, she was such a wonderful guest, and we can reach back into the library if you want to listen to that,
Mhm.
anybody out there. And then I also had a wonderful guest on who was in her 40s and had PCOS all her life and had given up on conceiving a child, she and her husband. And lo and behold, did ideal protein to she was starting to see some changes and to lose some weight. Didn't even consider it and turned up pregnant, I believe, at the age of 44.
Wow. No,
And
that's
she and her husband, she said it was a blessing from God, and they were so excited about having this child. And again, we refer to those as ideal protein babies, IP babies.
no, that's great. That's great. Yeah.
Yeah.
Um,
So
you
I
know, go ahead. I'm
no,
sorry.
you go ahead.
No, I was just also gonna say, like, sometimes when we talk about menopause, especially when I was talking about all the things that decrease as we enter menopause, it can sound so doom and gloom. But I
Yeah.
think one of the things I just want to mention to our listening audience is that there's so many myths out there, like, oh, you have to gain weight and you cannot take that weight off.
Right,
um,
right.
Permanent weight loss, there's just a lot of I think noise out there, that even though, yes, it is more difficult. We talked about a lot of the hormone effects and the belly fat and all these things, but I feel like very strongly that with a good plan of action, like I said, it's a multifactorial targeting all the aspects. But if we think about just getting healthy, if
Yeah,
we
right.
focus on our ultimate is to stay healthy and age gracefully and have a protocol plan, the right people help somebody, if you need help in terms of optimizing hormones, stress management,
Right.
um, you know, how to deal with adrenal fatigue, as we were talking about, it's very doable. I remember back in I don't think I told you this last time, but back in residency and med school, I was a good, I think, 18 pounds heavier back then too. Talk about adrenal fatigue during residency.
Right, 100%. No sleep, stress, all the things,
Yeah,
right?
and I know everybody has different. It's not about how many pounds or things, but if we continue that, path and being menopause at 35, you know, what I want to appeal to people is that it is possible to stay healthy, but you
Yeah,
have to do your
yeah,
part. It's not
yeah.
just about taking a medicine. It's not just about taking a hormone. It's
Right.
the whole package.
Whole
I
package.
think that's
You know,
important.
you've mentioned it a couple times, and I did want you to touch on the idea of hormone optimization. That was one of the things that I read on your website that you do, and you do it in a very specific kind of a way. There's, like you said, old myth has been debunked, and there's actually kind of new approach to the hormones that you use.
Yes, I think one of the things I was mentioning to you is that we use what we call bioidentical hormones, or
Yeah.
online you'll see BHRT. Um, there are FDA approved bioidentical hormones. I wanted to kind of clarify that term because I think even physicians sometimes, a lot of my colleagues were not trained in the area, don't really know what that means. And BHRT basically just simply means that the structure, the chemical structure of the hormones that you're being prescribed is exactly the same chemical structure as your own estrogen and as your own progesterone. So it makes sense, right? We know in
Yeah.
chemistry, you just even flip a molecule upside down, it
Right.
could behave totally differently. So the whole idea of being using bioidentical hormone is not to have any extra changes in the hormone replacement that you are getting. And so it
Gotcha.
doesn't, yeah. And so, FDA has plenty of bioidentical hormones that you can get a prescription for from your physician, that you can get it covered by insurance. The confusion sometimes comes into compounding pharmacies making. So there's the only reason that would be compounding pharmacy, and there's plenty of very good accredited compounding pharmacies that I work
Yeah.
with,
Yeah.
where they get accredited every year to make sure. So compounding is just basically like, for example, if you don't have the dose that the pharmaceutical company is making, so you have to make something specific for somebody. So like, if
Got
somebody
it.
is just using progesterone 100 milligram, that let's say they need 135. Well, you're not going to get that from Walgreens, basically. So you have to
Gotcha. Okay.
right dose. And so we use basically bioidentical hormones. I'll compound it if either the dosage or the method, or if I feel like there's intricacies where we can add different things. It's like a whole art of it to try
Yeah.
to mimic our body's needs, basically. But just so that people know that hormone replacement therapy is now actually recommended, and all the things that we know can be beneficial improves in terms of our cognitive function, the cardiovascular benefits, obviously, bone density protection. So definitely
Wow.
speak to your physician if you are, especially that first 10 years of menopause. We know the benefits definitely outweighs any risks, and it
Wow.
doesn't cause cancer. That's all
Right.
been debunked.
Yeah.
So I think with the right provider, I would encourage people, especially if you're trying to lose weight, I do think it is important to optimize hormonally if we can.
Wow. Yeah. And such a great message of hope, right?
Yeah.
Like I think, like you said, I think there's a lot of misinformation out there. There's a lot of just old myths that are out there that women tend to get the doom and gloom sentence once they're perimenopausal, right?
And I think, one of the people, and I shared with you last time, is this is actually my sister-in-law, and she said
Yeah.
that I can show her on our little presentation here. So my sister-in-law actually has struggled with her weight as she enter, I would say, like kind of more the 40s, basically.
Okay.
And also metabolic syndrome, diabetes, high triglycerides, low HDLs, heart disease, they all run in my
Right.
side of the family. So it was getting a bit concerning. So initially I had introduced the IP program to her. And initially, she was struggling a bit with it. And I was trying to find out. So one day, I looked at the email she sent to me. Now she was only on it like for a little bit. And I looked at it and she goes, "Oh, I'm just having so much trouble with the weight." And I'm like, "Why are you sending me this email at 1:40 in the morning?" So, and so that's where we started to
Yeah.
first correct the sleep habits.
Right.
Um, but I'm proud to say, she now have lost. Last I talked to her, I think when we talked it was 35 pounds, but now she's over 40 some pounds down and still going strong. The nice thing about it is that she feels comfortable, confident. She is menopause and doing it, and
Yeah.
also she
Right.
knows how to navigate. Like I also know it's an educational thing for her. When she goes to restaurants, she knows how to eat, how to not feel deprived as if she's on a diet, and she's
Right.
happy and she's
Yeah.
empowered. So I want
That's the key word. That's the key word right there. She's empowered, right?
yeah, and I would love for all our dieters, because it's difficult to deal with our weights, but it's doable. And as I said, these are some of our other menopausal success, people who do the program and they are losing the weight in menopause. I
Yeah.
think it showed you, these ladies are great in terms of of following the program and
Yep.
feeling good on it.
Yeah.
Um,
Well, and I think that's also just a really great. People are so focused on the pounds and they're so focused on the weight, but they feel so much better, right? That to
yeah.
me, I think that's the biggest thing, the biggest message, and the thing that I tell them to tell their friends and family when they say, "Oh, go ahead, you can have a little bit of this or you can eat that." Say, you know what? No, I'm just starting to feel really good again, and I want to stay this way for now, right?
Yeah, no, I also usually just tell people, do your thing. For some reason, other people, whether I don't want to be cynical, it's not, intentional, but for some reason there are unintentional sabotagers.
Yes. Yes. Oh, whether it's subconscious or conscious.
Yeah.
Yes. Keep going.
So do your thing. You don't need to announce to anybody that you're doing a protocol. Embrace what you're doing. Know that you with each week you're getting better to it, and know that you're learning something that's great for yourself.
Yeah.
And do it. It works.
Yeah. 100%. The bottom line, right?
Yeah, it works.
It works. Excellent. Well, Linda, I think that we've actually touched all of our bases. I think that we did cover things even a little bit more in depth and a little bit better than we did last time. So we're gonna look at that as a blessing and not a curse.
No, I hope so. And hopefully Google cooperated with us.
I right, exactly. Yeah. Any last minute things that you wanted to say or words of wisdom or messages to get out?
I think I, just want to, once again, just stress it's not about no pain, no gain, because I don't really think this is a painful process.
No.
I think if you put your mind to it, you can do it. And I know we talk mostly about ladies, but I take care of both men and women. So
Yep.
today is about female hormones and things. And just know, m- men can do this also. They have their own hormonal shifts. And I just wanted to also put it in there. They go through the same struggles, and IP works great for both.
Absolutely. 100%. Fantastic. Well, thank you so much, Dr. Linda. I'm going to send you backstage. I'm going to bring this to a close and hopefully it will work. And then we'll chat in a bit.
All right, thank you so much. Bye
Thank
bye.
you. Oh, so again, once again, just a brilliant show from Dr. Linda. So many of those insights, like very educational for me. Like I said, not understanding a whole lot about menopause and about the female hormonal system. So it's certainly an episode I'm going to be referencing over and over again. So as always, please, if this struck a chord with you, if you identified with us, let us know, and also share it. Like, share, subscribe. Send it to your friends, especially your friends that might be struggling and concerned or given up on weight loss now that they're in menopause, because this is a message of hope. And we were happy to bring it to you. So look out for some really amazing new episodes that are coming up. And as always, keep pursuing your own life possible.
That's a wrap for this episode of the Life Possible podcast, where we unlock the power of metabolic health to fuel your best life. If you found value in today's conversation, don't forget to like, subscribe, and download the podcast so you never miss an episode. And if this message resonated with you, share it to someone who needs to hear it. Let's spread the power of life possible together. For more inspiration, insights, and exclusive content, be sure to follow us on Facebook, Instagram, and LinkedIn. Thanks for tuning in. Keep striving, keep thriving, and remember, your best life is within reach.